Hi, my name's Megan, and I'm going to be talking about portion control for weight loss. It is important to choose the appropriate amounts of different foods. When deciding how much to eat, people generally assume serving size and portion size are the same thing, even though they are not. Serving size is a standardized amount of food. Serving sizes are sometimes used to quantify recommended amounts, such as MyPlate food groups. On the other hand, portion size is how much food you choose to eat, which may be more or less than a serving size. It is easy to underestimate how much you are eating. Portion control helps you get the benefits of nutrients in foods without overeating. It helps you digest food easier, maintain a healthy weight, control blood sugar levels, and stay energized. If people lower the energy density of their diet, they can eat satisfying portions while managing their weight. There are many strategies that can help individuals estimate portion sizes. One of these strategies is to use visual cues to eyeball different serving sizes. For example, 1 cup of cold cereal is about the size of an average adult fist, and 1 cup of cooked vegetables is about the size of a baseball. Another strategy includes knowing the sizes of your bowls, cups, and plates. Portion control plates can also be a useful tool. This can help people make sure they're consuming the right amount of fruits, vegetables, grains, protein, and dairy. Also, individuals should avoid eating straight from packages. Instead of eating a full bag of chips in one sitting, individuals can pour a small amount into a small bowl or container. It is also important to note that most people are served more food when they are eating out. A strategy for this is to split your entree with a friend or ask for a to-go box and wrap up half of your meal as soon as it arrives. One study focused on evaluating the effectiveness of using a portion control plate to promote weight loss in a primary care setting. 65 obese patients were recruited and randomized to either the portion control intervention or usual care, where participants received handouts on diet and exercise. The portion control plate was divided into 3 sections. One half of the plate was vegetables, 1/4 was fish, lean meat, chicken and nuts, and 1/4 was potatoes, pasta, rice, beans, and whole grains. Participants were contacted at months 1, 3, and 5 by a dietitian in order to receive additional counseling on portion sizes. Results showed that participants in the portion control intervention had a significantly greater percent change in weight from baseline to 3 months and a non-significant change in weight from baseline to 6 months. This study suggests that using a portion control plate intervention might be a successful strategy for weight loss in a primary care setting. One way to control portion size is to utilize prepackaged foods. The aim of the study was to test if providing portion-controlled, pre-packed lunch and dinner with a reduced energy diet and behavioral counseling promoted greater weight loss at 12 weeks in overweight and obese men than a diet that was selected by participants themselves. 183 participants were randomly assigned to 3 groups. One where the meal plan consisted of any variety of pre-packed entrees, one that offered only entrees with over 25% of energy from protein, or a meal that was selected by participants themselves. Every participant met with a dietitian initially for 1 to 2 hours for a diet plan and counseling session. Each participant was to consume a diet of 500 to 1500 calories a day. At 12 weeks, weight loss for the regular entree, higher protein entree, and control groups was 8.9, 7.8, and 6 pounds. At 3 months, a greater proportion of intervention than control participants had over 5% weight loss. Waist circumference decreased in all groups. Intervention participants lost an average of 5.7 kilograms of body fat compared to 4.4 kilograms of body fat in the control group. This study suggests that providing portion-controlled, prepackaged foods along with behavioral weight loss counseling sessions results in more weight and fat loss than a self-selected diet. The aim of this randomized controlled trial was to research the effect of an educational intervention program called Portion Control at Home on BMI and portion control behavior. This program examined the effects of a multi-component educational intervention that focused on portion size and portion control behavior and weight change in obese and overweight participants. 278 participants were assigned to the intervention or control group. The intervention group received the portion control at home intervention for 3 months. The intervention consisted of 4 components: portion size awareness tool, portion control strategies, portion control cooking class, and portion control home screener. Body mass index was calculated at the 3rd, 6th, and 12th month. Portion control behavior was assessed using a 32-item questionnaire that asked about strategies participants used in the portion control at home program. The scale ranged from 1 being almost never to 2 almost always. Results indicated improved portion control behavior at months 3, 6, and 12 months follow-up. BMI was significant only at 3 months follow-up. This study suggests that portion control at home program can be effective in improving portion control behavior and weight loss early on. However, more research needs to be done to study the long-term effects of this program. The last randomized controlled trial I am presenting aimed at researching whether the effectiveness of a behavioral weight loss program was increased when incorporating 2 different portion control strategies versus general information on how to eat less. 186 women were randomly assigned to one of 3 groups. The first group mentioned was the standard advice group. This group was told to follow dietary guidelines that include eating less and choosing foods from all food groups. The second group is the portion selection group. This group was told to choose foods based on their energy density. More specifically, participants were instructed to choose lower energy density foods and control high energy density foods. The third group was the pre-portioned foods group. This group was instructed to learn food portions by using pre-portioned foods. Results showed that participants in the pre-portioned foods group had more weight loss initially than the other 2 groups. However, the pre-portioned foods group also had more weight regain than the other 2 groups. Overall, groups that received information on portion control strategies did not result in greater weight loss than the other groups. The pre-portioned food groups had significant weight loss early on, but this was not the case long term. While there are many strategies to lose weight, I think portion control is one of the most effective ways to do so. Unlike many other strategies, portion control is an easy, affordable, safe, and effective way to lose weight. Almost all of the studies that utilize portion control strategies resulted in weight loss. Unfortunately, portion sizes have significantly increased over the years. Research has shown that people eat more when they're offered larger portions. For example, if I'm at a buffet with an unlimited amount of food, I eat a lot more than if I'm given one normal-sized plate of food. Portion control is important in avoiding weight gain. There are many strategies to control portion sizes. Some of the strategies in the studies included a portion-controlled plate, using everyday objects that represent appropriate portion sizes, and consuming pre-packed, portion-controlled meals. I think that meal prepping is also an acceptable way to control portion sizes. The best way to control weight is to eat when you're hungry and stop when you're full. However, sometimes I believe that some people don't know how to stop eating when they're full. That is why it's so important to make sure to control how much you're eating. I also think it is a good idea to eat healthy foods that keep you full for a longer amount of time, like protein and fiber, to avoid overconsumption. These studies provide evidence that portion control can significantly influence one's weight. More specifically, evidence has shown that decreasing portion sizes is an effective strategy for weight loss. Here's what you can do going forward. Evidence has shown that sizes of plates, spoons, and glasses can greatly influence how much someone eats. It's recommended that individuals use smaller breakfast, lunch, and dinnerware in order to avoid unconscious overconsumption. Another strategy is to use a portion-controlled plate. This can help individuals consume the correct amount of macronutrients for a well-balanced meal. As mentioned earlier, individuals can also use visual cues to eyeball how much they're eating. It's also a good strategy to eat slower. Eating too fast can make people less aware of feeling full and increase your likelihood of eating too much. Overall, I highly recommend using a portion control to maintain a healthy weight. It's an extremely effective strategy at a very low cost or sometimes no cost. I would start with measuring your cups, bowls, and plates, and as time goes on, it will be easier to eyeball different portion sizes.